Perhaps one should reflect on one's personal journey. So I've been in the field for, I'm trailing Pat, 35 or 38 years. And if I take my own personal experience and from what, doctors did in the day to what they do currently, I think that is demonstrative enough. But be that as it may, I think that, if you look at it from a healthcare provider perspective, your data collection, health metrics, for example, of risk factors, this is all technology. You can do it in real time. So, just by digitally collecting the data of unmodifiable factors like your family history, genetics, and so on, and your modifiable risk factors like blood pressure, glucose, cholesterol levels, your behavioral history, and so on, you can very, very quickly get to a risk profile of the patient in real time. So that to me is like the most amazing thing about the advancements in technology in the health sector. Because you're able to collect the data in real time, I think then obviously your diagnostic capabilities, your detection of medical conditions, all those conditions associated with cardiovascular disease, which includes strokes as well, not just, cardiac conditions. Also then, technology has improved all of that exponentially. I also believe that from a healthcare provider perspective, again, your medical decision making is, that becomes much more efficient. You could make your decisions based on the evidence, based on you can even have that hypertension guideline, for example, side by side with what, you're seeing in your patient or the person in your care. So, I mean, in one, look at one or two screens in that moment, that is what the power of technology. If one is able to then detect and diagnose so efficiently, the referral pathway becomes a way more efficient and effective process. And it enables the patient to get the right medical treatment, the right health interventions from the appropriate medical specialists. I think that also what I've seen is, I've been in the field so many years, I've spanned communicable and non-communicable diseases. One of the things that technology really, really holds in on is you can detect more than one risk, or more than one condition, I should say. And you can detect the severity of that risk. And so for triaging patients, it becomes much more efficient in an emergency situation. And then finally, and there's a lot more I can say. I'm just going to quickly look at some of the important points I want to get across today. But self-management, I think it's something we often don't think about. We don't really hone in on it too much. But technology has enabled self-management. Obviously, you can't do without a well-trained doctor, but definitely helps in the process. Of course, you're going to talk about the REAN app, for example, that helps in self-management, helps in day-to-day monitoring and so on. And I think the beauty ultimately of the technology is that you get to a very granular level. You can be able to say, well, this person needs more physical activity or decreased red meat in their diet and so on and so forth. So I think that we often think from a medical perspective, and this is not really only about doctor-driven, but this enables technology and enables all healthcare professionals for the betterment of the patient per se. So, patients have a much better deal today than they did many years ago.